Hello, everyone, and welcome to the ACLU Sacramento and NLG Sacramento joint event where we are having a community roundtable with newly elected County Supervisor Rich Desmond. We're all very excited to hear about Supervisor Desmond's plans, and we're also very excited for him to hear about the things our community cares about. The ACLU Sacramento and NLG Sacramento are joined by several important organizations that are grassroots within our community. We have here SAC Act, Decarcerate Sacramento, Live Free, Poor People's Campaign, the People's Budget, NorCal Resist, Sacramento Immigration Coalition, International Rescue Committee, and the Interfaith Movement for Human Integrity, along with, of course, the ACLU and the NLG. We've brought together a group of community leaders from all of these organizations to raise important questions around topics that we care about. Today, we're going to cover COVID-19, homelessness, sheriff oversight, sheriff incarceration, ICE transfers, and finally, the participatory budget. So without further ado, I think we're just going to get started right away by talking about the major issue in Sacramento, COVID-19. So first we have Miss Charlie Temple. Miss Temple currently works as a well-being coordinator at the International Rescue Committee in Sacramento. The IRC is a refugee resettlement agency operating in the United States, and it does global humanitarian work. Miss Temple.
Thank you, John, so much. And thank you, Supervisor Desmond, for your time and attention tonight. As John mentioned, I'm the Wellbeing Coordinator at the International Rescue Committee here in Sacramento, and we work with refugees, immigrants, and special visa holders, as many other ORR populations. And hopefully you're familiar, but the Arden Arcade area has a huge refugee population. And so I'm here to talk a little bit about COVID-19 and the response and some needs in our client communities. When we look at the work we've been doing in the last year, going remote for the safety of everyone has been awesome, but we have not had the same language access opportunities for our clients. And just, they've been kind of left out of information dissemination and kind of having to rely on community members or maybe some inaccurate local news sites. And so we want to make sure that they're integrated, that they know exactly what Sac County is doing, what our district is doing to support them. And then another big barrier issue that we've had is just, again, making sure clients understand the safety, the long-term, short-term effects of the vaccination. There are a couple of myths we'd love to demystify. And then last but not least, accessibility. Sacramento is growing in public transportation every year, but a lot of our clients who are newly resettled refugees don't have the ability to have access to consistent, reliable, and safe transportation. And this is a huge barrier when it comes to them accessing COVID testing sites, vaccination sites, and information. So these are some of the things that I wanted to highlight to you today. The refugee community is large, really growing in Sacramento, and we want to get them involved in the COVID-19 response, get them on board, and make sure that they're included as our whole Sacramento community as well. So we do a lot of work at the IRC to bring in folks from Sac County, from Dignity Health, those that have that accurate scientific data and information so that our clients have that immediate access and information to them, but definitely something that we think bringing in your help and support would be a great advantage and a benefit for our clients. Thank you.
Thank you. John, do you mind if I?
Yeah, that's exactly how this is going to work.
Thank you. Yep. And first, again, thank you for having me. And when Alan brought this up to me to do this, I said, well, I know you initially invited me to participate in a debate during the campaign, and so now that I'm here, the most important thing for me is to hear from you and listen and find ways that we can work together. And Charlie, it's a pleasure to meet you, because I'm well aware of that, of the very large refugee population, and in conversations with Congressman Bera's office, we're going to be getting more refugees settling here. And it is my, goal and responsibility to make sure that these refugees that government is responsive to their needs and government is accessible to them. And a lot of that is education, right? Breaking down some of these barriers, making sure they know what kind of services are available, and making sure they know how government can help them. And so, Matt Chicato and I have talked about this from Mr. Bera's office, and it's great to meet you, actually. And I hope would you send an email to my office? Because I would love, and I've been asking some community members who are kind of involved in the periphery with the population to try to help get them services, including the community prosecutor in this area who looks at some landlords who are really taking advantage of the refugee population. And I see Shireen nodding. This may have come up when I talked to ACT about this. I would love to make contact with you, Charlie, and maybe you can help me make some introductions into the community and start establishing that kind of level of trust with the community. That would be really great. And everything you're saying about the vaccines, not only to the refugee community, but to all the underprivileged communities in my district, in West Arden Arcade and North Highlands and Foothill Farms. I've been really pressing Dr. Kasiri, who is wonderful, that, hey, don't put all the attention in the city of Sacramento. A lot of times the unincorporated areas that I largely represent, right, my district is almost all unincorporated. A lot of times they're left behind. And some of that is because 300,000 people have one elected official to represent them. So I need help from you and others to help make sure we get the resources and access for them. And when it comes to vaccines, there's nothing more important than that right now. So thank you for bringing that up. And I share your concern about all the things that you talked about, and hope we can work together.
Thank you so much, Supervisor Desmond. I really appreciate that. And I'll definitely be following up with your office.
Great.
Shireen has been a wonderful connection in all of this. So I'm just more excited to get our clients connected to government and our local community. So thank you so much again for your time tonight.
Awesome, thank you. Next we have Suzanne Georgie, board member at ACLU Sacramento.
Hello, Mr. Desmond. Thank you so much for making this time to be with us. My first comment has to do with the time period before you joined the board, and this is the initial county's response to COVID. It was a real dismal failure. The county obviously did not budget for public health for operational success. Public health lab, health officer, public health nurses, the staff, they're to be our front line in the bioterrorism epidemics. For decades, that's their mission. Yet it appears public health was not funded and supported. And as this disease wreaked havoc in our county, the county did not initially allocate CARES funding to the public health. There were other things that have been reported, disrespecting the health officer and the function of public health. These are all signs of an institutional mindset that hindered the county's success in meeting this public health challenge. As a county supervisor, I'd like you to be alert to this institutional barrier and make sure that future county decisions support the health and well-being of our community. Secondly, intrinsic in the nature of public health is the need to meet people where they are. This philosophy is in the DNA of public health. The mission of treating and containing communicable diseases completely embraces this philosophy. And yet, the county's response to COVID-19 hasn't. And this doesn't make sense. Testing, it wasn't where people were. Heavy car dependency, not in the communities of color. Our county experienced a higher mortality rate for the Black and brown populations. Was there sufficient access to testing sites? And had we done contact tracing, we would have had better data as to the challenges these communities had in accessing medical care and wraparound services. Our vaccine distribution, it's mirroring some of the same problems of inequity. The public health mission is to meet people where they are for the betterment of our community's health and well-being. So why the inequity? Is it because the state handoff is to an insurance company that's too far removed from public health? Is it only knowing about the amount of vaccine coming 1 week ahead? So we are dependent upon distribution by larger players who have the fiscal resources, but again, are far removed from the public health mission. To meet this moment and to be true to the core mission of public health, we need to leverage and fund existing community partners to bring the vaccine to the people who need it and to help communicate in the language of their community to create a consistent and reliable way to reach people where they are. People work odd hours, don't have cars, don't have an internet password. These are challenging circumstances and they need to be met. So we need to reach everyone equitably into our community. And then on another matter, beseech you to use your political power to ensure that Sacramento gets its fair share of the vaccine. It seems as though Sacramento might be getting a little shorted in the supply of vaccines. And third, and really most important, is the surveillance. There's a federal grant of nearly $60 million for testing, case investigation, contact tracing, containment, but it might not be enough. We need to step up now and do the necessary work to detect where the community spread is going. During this time, as the case numbers are down, the county needs to step up to disrupt the virus. Essential surveillance plan is testing asymptomatic people. The currently strategy seems to only test people who have symptoms, which misses huge populations. Contact tracing. Everyone who tests positive needs to be traced to interrupt the spread. The data gathered, tracing contracts must be done quickly to isolate and disrupt the spread. It provides information to the people about their symptoms, hospitals, medications, and we can support isolation with housing, food, health, wraparound services. We also need to step up and do genetic testing of the samples to identify variants. Mutations are inevitable if we have the virus in our community. And come July, June or July, our most vulnerable population will be the children. We need a detection system, the canary in the coal mine, so to speak, to know we have a problem. We can't wait until it's the children who are being impacted. No one wants a shutdown. It's an extreme measure to be taken when everything else fails, but we never got ahead of it. Now's the time we can get ahead of this disease if we put our efforts in. Right now, 1,500 deaths has not been an acceptable outcome. Thank you.
Thank you, Suzanne. Yes, over 1,500 deaths and over 95,000 cases in Sacramento County. I agree with everything you said. I'm not as familiar with that $6 million in federal money for surveillance. I certainly will follow up on that. There have been some abysmal problems with how we have responded and to this crisis. I mean, certainly starting at the federal level. Now where we are with, I don't know if you're aware that Dr. Kassiri, she does every other week, she does public forums about where we are, kind of the state of things in Sacramento County and the vaccine, the process with the vaccine rollout. And you hit on some things that are really crucial. I mean, I think the short answer about that, it was kind of a rhetorical question, I think, about the state and the number of vaccine allocations we're getting and whether those are going to the major, big, influential healthcare companies. That is happening. I know that's been a big challenge for Dr. Kassiri and our Sacramento County Department of Public Health, really inherently limiting how much it can do in some of these disadvantaged communities that you're talking about. And I know she's trying to do the best she can. The supervisors are really working, I think, hand in hand with folks in our Sacramento County Department of Public Health. But those challenges that you relayed, those are really impediments to doing more. I think some really great partnerships are being formed with, like, United Latinos is helping host a clinic at St. Philomene's Church in West Arden Arcade on Saturday. I'm pushing for us to do a clinic in Foothill Farms. As you know, Grant High School, they've done a few there, but we need to do a lot more. We need to do more pop-up clinics, like you mentioned, in places where people can get to via transit or via walking that are in their neighborhoods. And that's something I'm very, very focused on. And I appreciate you bringing all these things to my attention. And as far as the culture towards public health, you're right. There was, before I came to the board, there was, I think, a real toxic culture in the county among county leadership. I'm glad that I think we're past that. I think there's a renewed focus on creating a culture that values folks who are working in our Sacramento County Department of Public Health and making sure they have the resources they need for this pandemic and how we're responding now, finally, but also making sure they have the resources they need going forward for when, God forbid, something like this happens again. So I really appreciate your comments, and I took a lot of notes. So thank you.
Thank you.
Awesome, thank you. So we're going to move from COVID-19, and now we're going to talk about another issue that's plaguing our community. Well, that is very concerning in our community. And we have Brother Kevin Carter here from the Poor People's Campaign to talk about the issue of homelessness and what can be done to help people.
Yes, good evening, Supervisor Desmond. I'm Brother Carter. I'm with the Sacramento Poor People's Campaign, a national call for moral revival. But I also work with a group here in Sacramento, which is called Services Not Sweeps. So before I ask any questions, I'm going to read the following statement here. Sacramento has allowed me the following information to share with you. All the unhoused folks opened and shared their stories with advocates. Bob Erlingbush, a director of the Sacramento Regional Coalition to End Homelessness, Services Not Sweeps, and its 25 plus organization members. And Bob is also a member in your district. Sacramento Poor People's Campaign, for our commitment to the center and impact of impacted voices and the table of those that are unhoused. We stand together in unification to address the urgencies when it comes to the unhoused being in the elements of the weather, where we have seen lives lost due to certain criteria that come from the county of what temperature the weather should be and how they address it. We see approximately 10 to 11,000 people that are homeless in the Sacramento County and city. And our question comes today is, when will the services be provided for those that are unhoused when it comes to basic needs? I'm one person that do basic needs at this time, where I supply them with sleeping bags, tents, hand sanitizer, mask, and all of these things are equivalent to go around COVID. But the most important thing is when the order comes out for them to stay in place, we constantly see sweeps that take place during these times when it's most urgent, even during the weather and when the COVID rises to these numbers. And the first thing that the county do is make sure that these people are displaced. And our question is to the county: how are we to keep these people in one area to where I've had the conversation with the COVID-19 community, such as Dr. Casilia and also with Bruce Wagstaff, to say that, the homeless are not sheltered, and it's hard for them to stay in place. So when the services come around to them, they're no longer there. So how do we stop this immoral action from happening around the homeless? And my other question would be, how do we address their issue with the COVID at this time, not just from getting the vaccine, but also from the testing, and then also for, like I said, for having a place to where they can be stabilized and not moved. One of the things that we've dearly been asking for is to how the county can come up with creating triage centers to where most of these folks that are along the river and other places can come to, and then that way you guys can bring the services to them. But it seems like it continues to land on deaf ears, and all that the city or the county wants to do is police the problem. And from my point of view, and that what I know about homelessness and poverty, you cannot police poverty, but you can legislate it. You can come up with policies. And what kind of policies do you have in mind at this time that we're still in the fierce urgency of now? And the reason why I say the urgency of now is because, as you see, the president has given money for stimulus to a lot of people here. But the last stimulus bill that was passed by the former administration, no one in homelessness received a dime. And now we're getting ready to go through the same criteria of them not receiving anything economically. And I think the best thing that can happen is if we can economically uplift some of these people that are homeless today, we would be in a better position. So I'm going to leave it at that. Thank you.
Thank you, Brother Carter. I appreciate it, and it's an honor to meet you. I've met with Bob Erlenbush. We had a great meeting, and I met with is it Joe Smith at Loaves and Fishes, right?
Yes, that's Joe.
And starting to build these relationships, and for me, homelessness, this is the moral issue of our time, and I think how we deal with this crisis and try to get help for the unhoused is going to be our legacy that we leave to our children and grandchildren. It is such I think a difficult issue. I mean, as it's as difficult to solve as it is difficult, all the difficult situations that cause someone to become unhoused to begin with. I'm going to start first of all with your point about the vaccines. I mean, I think it's a great point that you bring up about the CDC guidance and the public health order about keeping encampments from being displaced to avoid the spread of the disease. I think a good thing is that with this Johnson & Johnson vaccine coming out, that only requires one shot. That will really help us get the unhoused vaccinated. And I've had multiple discussions with Dr. Kassiri about that. That is going to be the strategy to try to focus using that vaccine, because as you mentioned, you may try to line up services and go back to share those with someone who's unhoused on the streets, and they may no longer be there. But I think the huge challenge we have, which you also talked about, is the lack of services. When I was, and I think you all know that I was a law enforcement officer in the highway patrol for 24 years. And there was a time when I was working down in Los Angeles, and it was probably in the early 2000s. And I was working the night shift, and we kept getting calls about a pedestrian crossing the freeway off the 105 freeway down near Crenshaw, and went out and found this individual. The person was clearly suffering from some kind of mental health crisis, was obviously a danger to himself. We had a facility down there where we could take someone who's suffering from a mental health crisis, took him on a 5150 hold, dropped him off to be able to get the help he needed. About a few days later, we got another call, same description of the individual, same location, and he had been camping out in an area between the off-ramp and the main portion of the freeway. We went out there again. It appeared to be under the influence of methamphetamine. It appeared like he had some methamphetamine on him. I actually arrested him for the methamphetamine at the time. Took him into custody in LA County. But clearly this was an individual in distress. Didn't really think anything else of it. And then about a week later, got another call about same time of night that a pedestrian had been hit and killed on the freeway. And it was this gentleman. And I made the impression at a very young kind of age in my career that, my God, we are failing a population of folks who are living unhoused in our streets by not getting them the help they need for their mental illness and addiction. And that's a perspective I bring with me to the Board of Supervisors. And it's become very clear to me that we have not done enough in not only the housing that we need for the unhoused, but for the treatment resources for substance abuse and mental illness. And you're right, Brother Carter, that we need a lot more. And I look forward to working with you and the Poor People's Campaign on finding ways we can get more resources towards these kinds of programs. And I'll also say this, I mean, this crisis is most importantly the impact it's having on folks' lives who are experiencing homelessness, but it is also having a big impact on our community and in our small businesses on the American River Parkway. And I think we all should be working with urgency to solve this crisis and find ways we can identify sites where we have more shelters and more meaningful treatment opportunities, places for folks to go. I mean, I think that there's nothing compassionate about letting a lot of people live out on the streets where they're exposed to the elements, where they're exposed to violent crime, because that is a reality. Some people are preyed upon out on the streets, where they are much more likely to suffer from either a physical or mental health crisis out on the streets. So I share the urgency with you, and I hope, and I told Bob Erlenbush this, I hope we can find some common ground where we can work on solutions together, because it is such a difficult issue, and it's going to take all of us working together to find solutions for it. But I certainly appreciate your comments, and I do think there's, one good thing is, as you know, Sacramento County got a lot of money along with the city to help people from becoming homeless in the first place with rent relief. And I think that's really good news. That's a step in the right direction. But obviously there's a lot more we need to be doing.
I just have one short piece to that I'd like to ask you. Okay, just recently here, we're getting ready to do a coordination under the bridges with Caltrans because they're going to be working on the freeways. Caltrans recently gave you guys $500 million for a project around homelessness. Are you willing to intervene in that to create housing for those homeless folks that are living along the corridors of these freeways, and put them into housing and create a triage center to where they can all adopt and come to? Because that's a lot of money, you know what I'm saying, that's geared towards them. I mean, the Caltrans is imminent to feeling that and feeling a great moral concern for those that are unhoused.
I hadn't heard that 500 million. I remember, I know what you're referring to, what's going on. I will tell you this, that I'm participating in a new 2x2 effort between the city and the county. Patrick Kennedy and I will be participating with our colleagues, Mayor Steinberg and Jay Chenier. And I promise you that we'll bring that up, and because I think that was money, I mean, that's in the city, right? But the county obviously has a huge role, and a lot of the housing funding money comes through the county. We are going to be talking about sites and locations specifically for the population of the unhoused that are going to be displaced by that project. So I promise you that's going to be a priority of mine, and we'll be discussing that on Friday and talking about locations, because that's oftentimes, as you know, the most difficult thing is finding a location that's suitable where we can bring in the services that we need, not just a safe ground, although that's part of it, but also bringing in, tiny homes or some kind of housing with four walls on a transitional level, because that's not a permanent solution for anybody. It shouldn't be a permanent solution for everybody.
Right.
But that's what we'll be discussing on Friday at this 2x2.
Okay.
So thank you for bringing that up specifically.
Okay, and thank you for your time. And I apologize to the panel for taking so much time. All right.
No, thank you, Brother Carter. This extremely important issue here in Sacramento County. And the comments about incarceration blend well into our next topic, which we want to talk about sheriff oversight. So first, we're going to hear from Shireen Miles, who is a community activist with Sacramento ACT and the Sacramento Immigration Coalition.
Hi, Supervisor Desmond. I'm so happy to participate in this. I wanted to talk to you on the part of the Immigration Coalition right now. One of our major projects has been to monitor the local implementation of SB 54. That is called the California Values Act. And what it does is prevent state and local law enforcement from working in collaboration with ICE, except in the case of dangerous and violent felons. Our Sheriff's Department's performance has been one of open disregard for this law and also for the Truth Act, which is another measure that requires any agency which does work with ICE to hold an annual forum so the community can hear about their actions. Here's what's happening. Our sheriff has not been accountable to the community, nor has it been accountable to the board on which you sit. I'm going to give you 3 examples really briefly. One of them is our request with Public Information Act requests. We placed one in July of 2017 to the sheriff. 3 months later, and you know that the requirement is that the agency must respond in 10 days. In 3 months, the answer we got is that they had no responsive documentation related to our request, which we were simply asking them how many ICE encounters have occurred in the jail or in our CCC facility. And we knew that had actually occurred. And then we also just did one March 2nd, and we still haven't heard back. So they're already outside of the 10 days. And in this latest one, what we have been requesting is records of the department's policies, procedures, guidance related to the implementation of SB 54, and also similar to the Truth Act, what kinds of internal memoranda went on, and what data related to that. So the first is non-response to Public Records Act. The second is that we did hold a truth forum. The sheriff was required to have that on December 15th, 2020. And the sheriff, who has been denying that any such ICE transfers occurred, was confronted with the fact that there was an individual that was sent to ICE custody, and he was illegally transferred to ICE custody. Now, this was not a violent offender. This was an individual who this was their first nonviolent offense, and that individual ended up spending 8 months in ICE custody as a result of the sheriff turning over this individual to ICE. The last part is that we are asking that the Truth Act forums be held during daytime hours. Right now, the county is holding them in the evening, and during the daytime rather. We ask that they be held in the evening because they've been held in the daytime, and also that they be properly noticed. The last notice went in the Sacramento Bee in the advertising section on page 67 in type too small to see. So we need meaningful oversight of our sheriff around issues of ICE and ICE transfers.
Thank you, Shireen. I mean, that's a lot of troubling things in your in what you relayed to me. Some of the things I took notes on, I will follow up on. I will say, it's funny, during the campaign, I'm obviously have the law enforcement background, but I was very proud to have worked in the legislature for the Highway Patrol and working on a lot of law enforcement reform legislation that improved openness and transparency and building public trust. And that's the lens. Even though I am someone who believes law enforcement have done right, it's a good thing. But I also believe law enforcement needs a lot of reforms. I worked on SB 54 with Senator De Leon's office, worked with a lot of the advocacy groups on that legislation, helped craft some of the provisions in that legislation, worked with the governor's office, and I'm very proud of that. I'm very proud of my work on that. And Dr. Weber's bill, AB 953, that you're familiar with, the Racial and Identity Profiling Act. So I'm aware of the provisions of SB 54 and the limitations that it imposed on transferring any in custody prisoners to ICE, and also the information sharing. You know, part of it, there's the Truth Act, there's also the Trust Act, and there were companion pieces of legislation that limited when law enforcement can interact with ICE at all, not just transfer custody, interact with ICE. And those were really, I think, progressive and good public policy legislation because of the large immigrant population we have in California and the importance of building public trust with the government that is supposed to be serving them here in California. So I was really proud to be a part of that. With respect to the PRA requests, I'm definitely gonna look into that, Shireen, and maybe even have my staff follow up with you to get a little more details, because that's inexcusable. And as far as that ICE violation that you relayed, that's also inexcusable. You know, as you know, the sheriff's department, it's a unique relationship with the governing body in Sacramento County. He's a separately elected official, and so there are constitutional limitations on what the board can do. Ultimately, at the end of the day, the electorate has direct input on who is elected as sheriff, and I mean, I happen to think that's a good thing, to have that direct benefit of electing who serves you as your chief law enforcement officer here in Sacramento County. But the Board of Supervisors needs more oversight. I like the new Inspector General MOU that was put into place. As you know, and as Alan knows very well, the county is going to be talking again about a Citizens Review Commission that is loosely patterned after Assemblymember McCarty's legislation. Oh, I'm forgetting the AB 1185 that passed last year, which, as Alan called out at the board meeting. I support that legislation. I talked to Mr. McCarty about it, and I'm going to support implementing something like that in Sacramento County. The issue that I was actually just talking about with one of my colleagues a few minutes ago was we have to make sure it's structured the right way, and that we've got to figure out how it's going to work vis-a-vis the Inspector General, but giving the Citizens Review Commission subpoena authority, and also figuring out how that subpoena authority is going to work with the Inspector General's subpoena authority is something we'll be talking about in a few days. And something that's important to me in that oversight is to also make sure it's balanced, whether you're talking about the RIPA board or talking about any other citizens oversight committee. I think it has to be balanced. I think that's important. So that's something I'll be talking about. But that's a good step in the right direction, Shireen. And when these if violations of SB 54 occur, or the implementation of the Truth Act is not being done in a way that encourages more participation, that is an area that I want to hear about, and I will certainly be asking hard questions of the sheriff's office about that, about why that's happening. Because just because the sheriff is separately elected does not mean the Board of Supervisors should totally abdicate, asking the hard questions and really leaning on that elected official and making sure we are provided with the information that we are entitled to receive. So I appreciate that and join you in some of your concerns that you've brought to me.
Thank you.
Thank you so much. And to take advantage of a little bit of privilege, if I could ask a couple of questions myself on the sheriff oversight issue. We have some pointed questions in the chat. First, on AB 1185. Specifically, do you support the idea of the civilian or citizen review board itself having its own subpoena power? It sounded like you did, but I just wanted to get a clear answer on that. And then,
I'm sorry.
Oh, and then the other issue is you use an acronym RIPA board. For everyone watching, RIPA refers to the basically racial profiling investigation that the DOJ does every year and submits a complete report through their portal called Open Justice that you can access and review. So related to that, do you support the idea of county RIPA boards to look at county data in a similar way?
Well, it's the first time I've even thought about that. I'd have to think about that. I mean, I think having worked on legislation at the state level, sometimes local control is a great thing, but sometimes it ends up resulting in inconsistencies. So I'd have to think about that, John, and would be happy to talk to the ACLU about that. I think a lot of these things that law enforcement statewide, I'm more of a proponent of having consistency statewide in a lot of things, especially when it comes to law enforcement. I don't really think, and of course I came from a statewide law enforcement agency. I think a lot of the problems that come up is because agencies, municipalities do things differently. So I'd want to think about that some more. And then when it comes to the subpoena power, I do agree with subpoena power for a Citizens Review Commission. I think what I had mentioned is, the problem is we have an inspector general here in Sacramento County too. So you could see, practically speaking, I want to make sure we implement policy that's going to be effective and that's not going to result in problems. For instance, if the inspector general wants to subpoena something and the CRC disagrees with what the inspector general wants to subpoena and issues their own subpoena, you can imagine there might be some conflicts. So I think the board needs to have a discussion about how this is going to be structured, and ultimately maybe it's the kind of thing where, hey, if there's a conflict or an inconsistency, it comes to the board to make a final decision on what subpoena should be issued or how we should proceed. But those are the kinds of policy decisions that are tough. I hate to keep bringing up my past, but working at the legislature and several of you I know are familiar with it. You have a bill's introduced and it goes to committee and it goes to it gets amended, and you have the opportunity to really wordsmith how the policy should be structured. It's been challenging for me here at the county level because we can't really do that. I can only talk to one other supervisor about some of this policy. So I think on something that's as important as citizen oversight, we need to make sure we get the policy right.
Thank you. Thank you for indulging me. Our next speaker is going to be Henry Ortiz. Henry Ortiz is a formerly incarcerated person. He is now a community healer and organizer. During his 18 years of incarceration, he wrote and facilitated trainings and workshops related to trauma and emotional intelligence. His various years of experience in teaching evidence-based model programs include teaching in prisons, continuation school, community colleges and universities, county jails, and the community at large. Mr. Ortiz.
Hi, Mr. Supervisor Desmond. On behalf of Decarcerate Sacramento, I want to extend our gratitude for voting against the jail expansion plan. Today, I'm here to talk about the need to think outside the box for the next 30 years. What is the system going to look like, right? Based on the decisions that you're going to be a part of making, and how do we go from this caveman mentality where you have to put a person in a concrete cage for years, decades of his life, and enslave them to involuntary servitude, and basically take 55% of their wages, right? And then enslave them to debts out here. Some of these community members have child support. They can't even get licenses to drive, to go to work. Some of them have mental health issues that are being hyper-criminalized and are being incarcerated because nobody really knows effective approaches. They don't exist. They're not supported. They're not substantiated with the funding and the investment to grow those systems out where we can transcend from a community of incarceration into healing, restoration, and emotional development and behavioral health, so that people can really get mentors and coaches to guide them through life, right? Being able to hire grassroots organizations who are out there in the front lines, who are not supported, who are not funded, who invent the innovative ways based on the circumstances and the decisions, based on the relationships that they build, right? But yet we all are having to be harassed constantly and continuously by the sharks that constantly go through our communities. When I talk about the sharks, I'm talking about the black and white sharks, you know. As much as healing work as I've done, I spent 18 years of my life in prison and you know, went in a very angry young man. And you know, got caught up in the 90s with the gang culture and all those circumstances, and was able to, you know, have extensive hours of understanding people's trauma and the governing factors to bad choices that led to mass incarceration. But in reality, as we've evolved in our knowledge and our research, we've also realized that we're being abused by a system that's based on white supremacy. A system that's governed from all the way from the way our military operates, and we've had abuses this past year. You know, Biden has made some changes there. You know, we've had you know, issues with the high rates of in California, high rates of brown people that are getting killed that are not even recognized. They lie voiceless. You know, across the country, our African-American relatives are suffering that burden at the highest rates. And it's the same thing in incarceration in California. Brown people make up 40 to 44% of the incarceration rates, while we only make up about 14 to 15% of, no, I think 12 at times, of graduation rates at universities, right? So, you know, our trauma, our upbringings in these neighborhoods of that are consumed by violence, by addictions and trauma and anger and rage and hypercriminalization. You know, I'm seeing also that we're over policing our communities. I can't tell you how many, every time I go out, every time I see a cop, I get triggered, because I have a lot of post-traumatic stress because of the institutionalized abuse of dealing with incarceration and having to watch for the cops since I was like 11 years old, right? Growing up in this community, this is our typical reality, right? And so, you know, we get caught up and even in doing the right thing today, I still have those triggers and those traumas. So I pay attention of how many officers surround me in cop cars everywhere I go, where I see them in the community. They're driving in sets of two. I'm like, why are we wasting all that gas? 2 vehicles for cops to just drive around all day, and then they're pulling over people that are either black or brown, who are poor, who are to the curve, who might have you know, a restitution fine or a fee, and now they have a bench warrant. Now they're going to get cuffed up. Now they're going to lose their car. Now they can't go to work, and it's a ripple effect of constant psychological and emotional and social abuse and economical oppression. And so, you know, that's not to say once we get incarcerated in the county systems, the conditions that we're forced to live in, some of the most dehumanizing circumstances, not even a third world country person lives in these types of conditions. And so, you know, we're incarcerating some of the most hurtful people. And like, so my question is, what legacy do you want to leave behind? And knowing the factors that we're facing in our community, especially here in Sacramento.
Let's make sure we have time for our remaining 3 speakers, please. Thank you, Brother Ortiz.
Boy, Mr. Ortiz, thank you, you know, for the question. And, you know, I'd love to talk with you some more. And you know, my friend Lynn Berkeley Baskin and I were talking about a lot of these issues recently. You know, it's through this process of running for office and getting to know a lot more community advocates and just listening and trying to hear, it's made me, you know, look at things a lot differently in my life. You know, I was in law enforcement for a long time, and my objective was to help people. I wanted to help people. That was my number one priority. And to be educated now about how some of the pain that is caused by law enforcement and incarceration is really, you know, it makes me struggle. It really makes me look at my life, what I've done with my life. I think to myself that as I hear you talk, I think I'm someone who believes that unfortunately we're always going to need law enforcement, but law enforcement needs to do a lot more listening to folks like yourself who can educate them about the impacts of this system that we have. I think we should all have the same goal, which is to have the least number of people incarcerated as possible. That should be our goal. Our goal should be to intervene in people's lives to prevent them from ever getting involved in our criminal justice system. I think there are some things we can point to in Sacramento County that are good things. Diversionary programs that avoid people even going to jail in the first place or getting arrested in the first place. We're having this discussion about the alternatives to 911 system, which is really an alternatives to law enforcement system. And I look forward to having more discussions about that, but also pretrial diversionary systems that we're putting in place here and investing more in those kinds of things. The reason I joined 3 of my colleagues in voting against the correctional custodial health facility, also called the jail annex and expansion, is because I think we haven't done enough evaluation of these other systems, and whether by investing in more of those we can avoid putting more money into this jail annex or this correctional health treatment center next to the jail. I think, unfortunately, the bottom line is that based on that consent decree and that settlement, we are going to have to build something because, like you mentioned, Mr. Ortiz, the conditions in jail are horrible. And, I've seen it. I've obviously been involved in that system, and I have taken people to these jails in Los Angeles County and Sacramento County and other counties, and they're horrible places. You're right. And I think part of this consent decree was to create different conditions in these facilities that, unfortunately, as a society, we're always going to have. But I think there's an awful lot we can do together to improve things. It's hard for me personally to hear that I spent 24 years of my life in a profession where I wanted to help people, but that so many members of the community view as a inherently racist system. And I think the way I get over some of these things, the way we can maybe improve things and heal some of these hurts that we have are by talking and listening to each other. And that's why I so much appreciate listening to you and hearing you tonight, and hope that, I would love to hear more about your story and about your ideas for things. So I know we need to keep moving on, Elizabeth, but Mr. Ortiz, thank you.
Excuse me. How you doing, Supervisor Desmond? My name is Raymond Garcia. I'm a constituent, also formerly incarcerated, spent 2 decades of my life incarcerated. And I just wanted to talk about prevention, and because if we invest in prevention, our system wouldn't be overcrowded. Not only that, but how dehumanizing it is, right? You've worked in the law enforcement for a long time, so it's really dehumanizing. I mean, getting strip searched in and out. I mean, the whole get down, right? The dirty conditions, the trauma coming out, transitioning back into society, mental problems. I know we're short on time, and I know you got to get back to your family. I just wanted to introduce myself. Thank you for your support, and we appreciate you. And also, I wanted to let you know over here on Bell and Arden, Auburn, there's some telephone poles, wires that are falling down, and like we need to really fix that. All them poles are falling down. This is the community. I live here. They're gonna break, pop. So if you could please try to work on that, Mr. Desmond, I appreciate you. I look forward to working with you as well. I'll turn it back over.
That should be an easier problem I can get to. Much easier than a lot of these other issues. Thank you, Mr. Garcia. I appreciate that. Thank you.
Thank you, sir.
And Mr. Garcia was one of our speakers, but I think that his intent there was to wrap it up. So we'll move now to Charles Joseph. Mr. Joseph is with the Interfaith Movement for Human Integrity. He's a spiritual activist. He's a hunger strike leader. He was in Mesa Verde, and while he was there, he is currently facing deportation and hoping for a pardon from Governor Newsom. Mr. Joseph.
I know we're really short on time, so I just want to say Bula to all. Bula is good life greetings in Fijian. Supervisor Rich Desmond, I want to just chant this chant for you. It's going to take about 30 seconds, kind of big blessing on your journey. And, expand on these conversations that we having, one thing I just want to say is there cannot be no exceptions or anything, exclusions to humane treatment. And I feel the spirit from you, and I wish you positive on this journey, and we can continue these conversations. Let's take real quick chant for you. Rongo saka nawe kangu, wasada e mai na tumbuni, salu e waka e lolo me sambai, lavu me sengai toka mengiri na walu meta, sita di meta, sita di mesa, so wiri da ketaleani. Isa wele ya da basara bangiri monita oda o atamata, hausa oda na asarab, aongai murimangai madala. Aongai murimangai madala. Much respect and much love to all. We are warriors in this movement. It's oneness we move towards, and just want to send that energy out there to all.
Thank you very much.
Thank you for that, Mr. Joseph. So we are at 6:59. Supervisor Desmond, we're trying to, righteously protect your 7 o'clock deadline. We did not get all our topics. We had another speaker on ICE transfers. That was going to be Gurdeep Dhaliwal with NorCal Resist. She will be sending you a short memo with what she wanted to say to either your email or your office. And then we also had wanted to discuss participatory budget as kind of a potential option for solutions to this. And that was with Bo Reynolds, who is also going to submit a memo to you with his thoughts on this topic and his organization and the people's budget. With that, again, thank you so much for your time. Thank you everyone for their questions. We try to get them into the chat and work them in as they came up. This was recorded and it can be distributed across your social media outlets. So if there's anything else, if Alan or Kim, if there are any other closing remarks.
I just want to quickly say this has been a phenomenal effort on part of all the organizations representing the constituents in the Sacramento County today. I can't thank you all enough for being here to represent our constituents. And of course, thank you to Supervisor Rich Desmond for lending us your time and your busy schedule to hear from our experts in the respective fields that they gave comments for. So thank you, everyone.
Thank you. And Supervisor Desmond, if there's anything you wanted to say in closing.
Just really quick. I mean, of course, thank you all so much. And I think that, look, I consider myself a very open-minded person, a person of deep compassion who wants to listen to all of my constituents. And there will be times we obviously disagree, but I think there's a lot of times we will agree. And it was just, Charles, I'm so touched by that. And have really enjoyed the conversation, and I really hope that this is not the last one. I know it will not be. So thank you again, and have a good evening. And I'm an Irish guy, so I've got to go celebrate St. Patrick's Day. So thank you.
Enjoy your family, Mr. Rich.
Thank you. Thank you all.
Thank you, everyone.
Bye-bye.
Thank you all.
Bye-bye.